This is a paper for third year BA Psychology students, semester 5, paper code PSC 105, paper title Understanding of Psychological Disorders. Title of the unit is Disorders of Anxiety and Mood, module name Anxiety Disorders and Phobia, Generalized Anxiety Disorders, module number 13. I am Dr. Frida Kota Pereira, Associate Professor at MES College of Arts and Commerce, Dwarinagar, Goa. The outline of this topic is defining generalized anxiety disorders, prevalence, age of onset, and gender differences, comorbidity with other disorders, learning outcomes to understand the concept of generalized anxiety disorders, learn the causes, prevalence, and comorbidity with other disorders. Defining generalized anxiety disorder. Generalized anxiety disorder is a chronic excessive worry about a number of events or activities with no specific threat in the present. The person who is facing from this problem, he is excessively worried over everything that's happening in the surrounding, with his work life, with his personal life, with his home family environment, with every situation that he is experiencing or facing. He is feeling worried and worked up. If he is a parent, then he will be excessively worried about the children, about the home environment, about the work and everything that is surrounding him. And this generalized anxiety is accompanied, when the person has this generalized anxiety problem, he will have at least 3 symptoms of the 6 symptoms he will be experiencing. And this generalized anxiety is also known as free floating anxiety. Now, this problem is experience subjective. The person himself is having this experience of excessive worry. He is so worried about everything that's happening surrounding him. And this must be accompanied by at least 3 of the 6 symptoms. The person having generalized anxiety disorders will be facing any of these 3 symptoms. Of these 6, the 3 symptoms he would be experiencing. Like being easily fatigued, he feels tired. Anything that he does, he goes to work, comes back home, he feels so tired. He goes to for shopping, or even if he's relaxing in the house, still he will be feeling tired with everything and anything. And he is having difficulty in concentrating with the work that he's doing. Then he has muscle tension in his body, excessive muscle tension. He gets pain in the back or pain in the head, pain in the body. He is unable to sleep well. He will have disturbed sleep. He gets up anytime in the night time. Then he feels very irritated with everything surrounding him. And he feels very restless because basically he is not feeling well. So he is feeling restless with himself and he gets irritated with everything that is surrounding him. Anybody comes to approach him for any problem, he will get irritated. DSM-4-TR specify that this is a worry, and this worry is about different events or activities that he must be experiencing, and these symptoms must be present in him at least for 6 months. Then if he is facing this problem for 6 months, then you would be saying that he is having generalized anxiety disorder. The criteria for generalized anxiety disorder is the anxiety causes him clinically significant distress to important areas of functioning. He is unable to concentrate on his work and perform his normal day-to-day work activities at workplace or at home. The person suffering from generalized anxiety disorder is always in a future-oriented mood state of anxious apprehension. He is worried about what will happen in the future with myself, with my body. If any kind of problem, health problem is there with him, he will jump to conclusion that, oh, I will get cancer and something serious will happen with me. If he's having blood pressure and he's having pressure problems, he will think that I will die with heart attack. So always he is jumping to the future, and this is the problem with his mood states. He is having disturbed mood state, negative mood state, and he is so anxious about what will happen next. So he is unable to stay in the present, rather he is most of the time going in the future. This is a disturbance which occurs due to direct physiological effects. This is not due to the direct physiological effect of substance abuse or general medication. The person suffering from generalized anxiety disorder is not suffering because he is drinking alcohol or because he is taking drugs or because he is under some medication. He is having this anxiety problem. He is already suffering from this anxiety problem, and with these impact of substance abuse or medication, the condition can worsen. He shows signs of marked vigilance of threat in the environment. He is unable to move freely in the environment. Whenever he goes out for shopping or for work, for his normal duties, he feels that everybody is spying him, everybody is trapping him. He is so scared about moving out of in the society. He is engaged in avoidance activities such as procrastination or calling a loved one to see if the person is safe. Every now and then he will delay the work. The work, even if the work is urgent, the person is told to submit this work and it has to be done urgently. He will delay this work and he'll keep saying tomorrow and tomorrow. So procrastination is one of the problem with the person with generalized anxiety disorder. Also, he will keep calling his loved ones, family members, supposing his wife is away or his children are gone away to study, they are not in the home, then he will keep calling up to check whether the children are safe, whether everything is fine with the children. This disorder leaves him continually upset and discouraged. He feels very disturbed, he feels very discouraged because he is understanding that I have a problem, something is seriously wrong with me. He can understand that he is upset. The worry is so endless over every possible error that he looks for unforeseen circumstances. Any unforeseen circumstance he may have to face. He is worried of how he is going to manage this problem. They have no appreciation of the logic over which they have no control. There are so many situations which are happening now. Pandemic today, there is no control. None of us can control this pandemic or the attack of the virus. None of us, if any of us are affected with COVID, there is no way that we can control ourselves. Of course, yes, we can use the sanitizers, we can use the mask, and we can take precautions and care. But if we already are facing or having, or if we are tested positive, then there is no way that we can just get rid of it and say, no, I'm negative. They fail to escape from the illusory world created in their thoughts. All these thoughts are created in their mind, created in their thoughts. Their thinking becomes excessively negative, and these people experience role impairment and they have a low quality of life. They don't know what is my role, what I'm supposed to do. Am I a parent or a student, or what is my next job, what I'm supposed to do next? Also, they don't feel happy in their life, so their personal life is always lot of depression, with lot of sadness. So there is no quality in their personal life. The prevalence age of onset and gender differences, generalized anxiety disorder people, they all face a common condition. Their problem is anxiety. 3% of the population suffer in 1 year period, and 5.7% at some point in their life come across generalized anxiety disorder. If they recover from this generalized anxiety disorder, then they get replicated by somatization disorder. So somatization disorder is another type of a problem wherein the person always feels that he has some or the other health problem. And this is characterized by multiple somatic complaints with unknown medical basis. So when the person is suffering from somatization disorder, there is no medical basis to say that this person is having so and so problem, and this problem is more seen in women than in men. People with this disorder manage to function in spite of their high level of worry and low perceived well-being. They feel so worried about everything that's happening around them. They have a low perception about themselves. They are not happy with the way they function, but yet they can work in a normal work environment. Whatever duties they are supposed to do, they will perform, they will do. They will not run away from their duties. They may procrastinate. They may next, tomorrow I will do it. They may delay the work, but finally they will do it. They are less likely to go to clinics for psychological treatment than people with panic disorder. People who have panic disorder, definitely they will go to a psychiatrist because, or they will go to a doctor. But these people will not go very often. People with generalized anxiety disorder frequently visit physicians with medical complaints. They will say that they are having high blood pressure, they are feeling dizziness, they are feeling vomiting, they are feeling all sorts of complications which are medical. You take some tablet and you get all right. This is what they think. Actually, they are facing a generalized anxiety disorder, and this gets developed in older adults who suffer from anxiety disorder. Comorbidity with other disorders. This occurs with axis 1 disorder like mood disorders, panic disorders, phobias, and major depressive disorder. Many people with generalized anxiety disorders experience occasional panic. Off and on they get panic attacks, and chronically anxious and experience mild to moderate depression because they are always sad. Why? Because they are not happy. They always think that something is wrong with me. So this sadness is so extreme that they can get into depression. If they take any sorts of drugs or sleeping pills or consume alcohol, and if this dosage is extra, more than the normal, then they are prone to get into a problem called generalized anxiety disorder. So these are the references where you will find this material, whatever we have discussed, you will find in this book, Butcher, Mineka Kule, 2014, Abnormal Psychology, 15th edition, Pearson, India, or William Ray, 2018, Abnormal Psychology, 2nd edition, Sage Publications. Thank you.